Hello everybody, I am Dr. Mervet Abou Gabal, Professor of Internal Medicine and Rheumatology in Shams University. Welcome to the presentation of Part 1 of lecture Infectious Arthritis. Infectious arthritis is a joint disease that commonly presents as monoarticular arthritis. What are our intended learning outcomes? By the end of this lecture, the students should be able to understand how can infection produce arthritis, define infectious arthritis, its types, pathogenesis, and clinical presentation. Learn when to suspect septic arthritis and how to confirm. Learn how dangerous it is and how to treat once suspected. By definition, infectious arthritis is inflammation of joints caused by infection with microorganisms. Now, how can infection produce arthritis? Through 4 mechanisms. Direct infection, where the organism directly invades joints, like in septic and tuberculous arthritis, the organism can be isolated from the joint. The second mechanism is post-infectious. Following hepatitis C and hepatitis B infection, where antigen-antibody complex containing antigenic part of the organism will deposit in synovium, resulting in inflammation. Here, the organism cannot be isolated from the joint, only its antigenic particle is present as a part of immune complex. The third mechanism is cross-reactive. For example, rheumatic arthritis and Reiter disease, where due to antigenic similarity between the organism and self-antigen in joints, antibodies formed against the organism cross-react against self-antigen causing synovitis. Here, no organism or its antigen inside the joint. The last mechanism is the inductive way. For example, in rheumatoid arthritis, where the organism, whether mycoplasma or periodontal infection, produce alteration of self-antigen like IgG. So they are recognized as non-self against which IgM rheumatoid factor is formed. According to the causative organism, infectious arthritis could be septic arthritis, viral, tuberculous, fungal, Lyme disease, or prosthetic joint infection. Regarding prevalence of septic arthritis, about 0.2% to 0.7% of hospital admission are due to infectious arthritis, with peak incidence in the first year of first decade and above 50 years. Males are more affected than females. Lower limb is more affected than upper limb. Regarding route of infection, hematogenous seeding is the most common route. However, extension from nearby sepsis and direct implantation are contributing routes. There must be a predisposing factor, either local or systemic immune compromisation, to get septic arthritis, like extra-articular infection, previous joint damage, chronic debilitating disease, immune suppressive or corticosteroid therapy. Pathogenesis of septic arthritis. The first part to be invaded by microorganisms is the synovium, leading to synovitis, hyperplasia, hypertrophy with pannus formation. Pannus, together with lysosomal enzymes produced by the organism and polymorph nuclear leukocytes, cause erosion and degradation of cartilage and underlying bone. The joint is converted to a bag of pus. If not treated, ankylosis and joint loss take place in few weeks. The clinical presentation of septic arthritis is acute monoarticular arthritis. Hip and knee joints are the most commonly joints affected. However, polyarticular septic arthritis can occur. Guess when? To answer the question in face-to-face session. Again, clinical presentation. The affected joint is painful with swelling, hotness, redness, and limited joint mobility. There may be fever. Now, what is dermatitis arthritis syndrome? Think till face-to-face session. This is an image of septic arthritis in knee and ankle joints.